When you think of getting penile implant surgery, first thing that you think is the penile size and the penile length. Hello everyone, this is Dr. Yashar Basha. I am Doctor of Urology and Andrology. I work as consultant andrologist in Istanbul. Today's topic is the penile length after penile implant surgery and the factors that are affecting penile length with the penile implant surgery. When people start thinking about the implant surgery, when they start to search, they see many posts about I lost my penile size, penile length, and there are many comments about the penile implant surgery. Let's talk about the factors that are affecting the penile length after penile implant surgery. Generally, the changes in the penis starts with the severe erectile dysfunction. The patients who are getting penile implant surgery are generally getting severe erectile dysfunction. Penis has two corpus cavernosum, which are spongy tissue that are filled with blood, and the covering layer called tunica albuginea, which is covering the penis and the erectile tissue. When the elasticity of the tunica albuginea, the most important point for the size of the penis when it gets erected. When the people start to get erectile dysfunction, the oxygenated blood goes in low amount to the corpus cavernosum, to the erectile tissue, and after the result of this low blood flow, we see the shortening of the penis and we see loss of smooth muscle located in the corpus cavernosum. At the end of this size loss with the erectile dysfunction, the patients are generally remember their erections when they are young. There are several factors that are affecting the penile length after the penile implant surgery. The first and the most important thing is the tunical fibrosis. The patients who are getting erectile dysfunction before implant surgery, they are using some injections, trimix and bimix or coverjet injections into the penis to get erections. The injections and some drugs cause some fibrosis in corpus cavernosum, in spongy tissue, and also in the tunica albuginea by the effect of the needle that are coming into the penis. And so after the tunical fibrosis, tunica albuginea, which is the covering layer of the penis, loses its elasticity. Elasticity is really very important to have longer erections for men. And we have a special disease called Peyronie's disease. Peyronie's disease also impairs the tunical elasticity and it causes shortening of the penis. And so with some injections and with some diseases just like Peyronie's disease, you can get shorter penis. And the Peyronie's disease has to be fixed for curvatures in penile implant surgery. We have to be sure about the technique used in the Peyronie's disease correction. If you use shortening technique just like Nesbitt technique and plication technique, you can get even shorter penis after the penile implant surgery. The technique is really very important, at least to preserve the length of the penis after the implant surgery. Another factor that are affecting penile size after penile implant surgery is the type of measurement, that the technique you are doing your measurements after implant surgery. For example, you are doing your measurements after implant surgery when you are not aroused, and when you are measuring your penis when you are not aroused, you don't have the engorgement of the glans penis, and which is the most important point to see your penis bigger than you have. And it's really very important to make your measurements, especially when you are aroused, or especially it's important in surgical technique to preserve the cavernosal artery to have engorgement of the glans penis after the surgical technique, because if you dilate the corpus cavernosum very harshly, you can lose the blood flow in the cavernosal artery and you can lose your connections between the dorsal artery and the cavernosal artery, and it can impair the engorgement of the glans penis and it can cause loss of size just around 1 centimeter after the penile prosthesis surgery. It's really very important to have a good healthy condition to have longer penis. If you gain weight, if you have obesity, you can have some fat around penis called suprapubic area. The suprapubic fat can embed the penis into it and it can have 2 to 3 centimeters shorter penis, and you can realize that your penis looks 2 or 3 centimeters shorter than you have. It's really very important to have a good condition without obesity, because obesity is also causing some erectile dysfunction, causing some decreased testosterone, loss of libido, and it can cause some vascular problems, and it can cause both erectile dysfunction and it can cause also shortening of penis because of the appearance around the penis. One of the other cause of the shortening of penis after penile implant surgery is the wrong measurement. The elasticity of penis and making the measurements correctly are really very important after penile implant implant surgery, because if you cannot measure your penis correctly, the surgeon cannot measure your penis correctly, you can lose some length after penile implant surgery. The measurements are really very important to preserve the angle of the erection and the length of erection. We have some special techniques to preserve the length after the penile implant surgery. Of course, there are some types of implants which can expand in length and girth. You know, the Rigicon and the AMS, Boston AMS LGX 700 has cylinders that are expanding both length and girth, and it's also very crucial to have to preserve penile length after the penile prosthesis surgery. If you consider about getting penile implant surgery, please contact my team and learn much more about details of the penile implant surgery, and please be aware of the surgical technique is really very important to preserve penile length after penile implant prosthesis surgery.